Health and Human Services. And Health and Human Services covers a lot of territory, Food and Drug Administration, HR Administration on Children and Families. But really what we're focusing on right now, you're not surprised here, this is topic on our agenda, is health care. 2 years ago next month, the President signed the Affordable Care Act, or what some folks call the Health Care Reform Law, or just the new health law. And, you know, there's 50 years, or actually longer, that presidents and Congresses have tried to find a way to get some substantial health care reform to expand coverage in this country. And the President made it a centerpiece of his agenda, you know, for very basic reasons. We talk about systems all the time, we talk about institutions all the time, but what we're talking about is people not suffering, people living longer, people having better care, people having better lives. That's the reason for this law. 50 million people who have not been covered by the law, because of the new health care law, tens of millions of those folks, most of those folks, will have access to coverage. That's sort of the basics of what we're talking about here. And among our communities, the communities of color especially have high uninsurance rates, and especially among our communities, Latino community has a very high rate of uninsurance, the highest rate in our country. About 9 million of our Latino population do not have insurance. So the health care reform law does a number of things. It seeks to expand coverage, as described very importantly, also seeks to stop some of the worsening abuses in the private insurance industry, and also works hard to hold on costs and increase quality. So the time I'll have to speak very briefly about those things. First is the consumer protection side. And one of the things I find interesting to me is, now I go and talk to governments and advocacy groups and others about the law, and what I find is, I think what was said earlier, is a lack of information, a record of misinformation, and it's really important for me and for us to talk later on about what the facts are, what the facts are not. And the consumer protection part of the law is in effect right now. It's not 2014, right now. The law bars what are called rescissions. Simply put, you have an insurance policy in the private insurance market. The example I use, someone is diagnosed with breast cancer. The insurance company, many of whom have had actually programs to look back at the insurance policies, look back when you applied 5 years ago, and if you didn't answer a question right, left something out, rescinds or cancels that policy. Right now, that is the law under the Affordable Care Act. And some of the things that people do not know about is important to talk about when we talk about what's good and what's bad. Right now, the Affordable Care Act bars insurance company from denying care coverage to children because of a pre-existing condition. So with so many, many people don't know about this should know about. The child who has asthma, and then you try to get coverage, and somebody says, no, he's not going to cover asthma because the child had that before. And that expands to adults, to all adults in 2014, but right now that's against the law. Right now, the law requires that for the premium you pay, for every dollar you pay for your insurance policy in the private market, at 80 cents that dollar, at least 80 cents, has to go to direct care and to quality of care, not to overhead. That's a new part of the law that just starts to affect right now. There's lots of other things that I will talk about later on, but when you talk to your friends and your communities of interest and others, we're going to talk about what the truth is and what's in effect now, not just what we sometimes think is in effect right now. So, the protection piece is important. The expansion of coverage piece is obviously extremely important. First off, there's an expansion of Medicaid coverage to cover 133% of the federal poverty level. That's all mumble jumble. Basically, the family of four that's making no more than $30,000 is eligible for Medicaid. Extremely important because we always talk about folks who are uninsured, and there are 50 million folks who are uninsured, but those folks often get care. They just get care at the wrong place, when it's too late, when it's too expensive, at emergency rooms, when they can't get the kind of care they need. So it's extremely important to get folks into primary care, into care earlier, to find the kinds of things that can be stopped from becoming something that shortens the life, that causes suffering, and incidentally costs a lot of money. So that's one part of the expansion of care. The other part of the expansion of care is what you may hear as affordable insurance exchanges, which is a nice number with a nice word with lots of syllables. It basically means that an expansion of your ability to obtain insurance in the private market for small businesses, for individuals, goes into effect in 2014, and it's something that the state legislators around the country are working to develop right now. I've talked to folks in Ohio, a lot of others in the upper Midwest here, and we've got a ways to go in convincing and persuading and talking to folks here that something that the state needs to be involved in setting the model for these new transparency insurance exchanges. Now, I'm going to, okay. As you can see, it can be subject to lots of pieces in a short amount of time. Let me just say, I'll say one last thing, and then I'm going to pass my last minute to Mr. Delgado to talk about some changes in Medicare. And the last thing simply is an overall part of the increase in quality. There's a prevention agenda to get people into care earlier, to have diseases found earlier, to have care closer to where folks are. So a big investment in community health centers, school-based health centers, so that you can get that care closer to where you are. And with that, I'm going to pass it to Ms. Delgado to talk a bit about Medicare.